Hello guys, my name is Faraz and from this video we are going to start the prescription writing properly, and from this video we will write the prescriptions using this template, using this case which is given over here. So in your exam like UKMLA exam or the PLAB 2 exam, when you will enter into the room for the prescription writing station, so definitely this type of the case will be there in front of you. Definitely this heading will not be there. Apart from this heading which I have just written, all this information will be there. Okay, so before going into the prescription writing, you have to note few things. First of all, you should be aware of the patient details, you should be aware of the consultant details, you should be aware which department it is, you should be aware about the task. So the task will be the writing of the new medication along with the ongoing medication, and you should be aware of what allergic status of the patient. And the sixth and the last thing is you should be aware like which medication is antibiotic, which medication is going in the regular medication section, which medication is going into the PRN medication section as required medication section. So let's start it. So what you have to do, you have to underline few things, you have to encircle few things. So first of all, underline department, that is ED. Then you have to underline the patient details. Mr. Strauss, aged 55, and he was admitted with the breathlessness and diagnosed. So diagnosis is very important. You have to underline the community-acquired pneumonia. Then you have to write the you should be aware about your consultant details because that are important. You have to write the consultant details as well. And your consultant is ABCD. He has advised you to write the clarithromycin 500 mg BD for the 5 days. So this is the new medication. This is the basically order which you have to follow. This is the main task. As I told you previously in the videos, if you are not gonna write the main task, that the antibiotic, but you have written all the regular medication, you will miss 4 marks. So the writing of the task is very important. And the next option, the next thing is very important, which is allergic status. Patient is not allergic to anything. Okay, so then they are saying like as a regular medication, this patient is on these medications, and out of these medication, as I told you, you should be aware which medication is regular and which medication is PRN. So let's read all the medication quickly, and just we will encircle the PRN medication. So here is the salbutamol, that is 1 to 2 of PRN. You should encircle this medication. You can underline, it's your approach. Okay, and the rest of the medication is BD, not PRN, BD. Okay, and all the medications are ongoing, not the PRN. They are the regular medication which you have to give patient in any case. What is the task? What you must do is the task, write down the prescription of all the above medications. Okay, so we will write a prescription of all above medications. So we are going to move down now. Please keep in mind, while you are writing a prescription, it is not mandatory like you have to open the BNF every time and you have to check before writing. If you are aware about something, why there is I don't think there is any need to open the BNF, but you have to pretend like you are opening a BNF and you are a safe doctor. So the purpose of the opening BNF in the exam is just to make sure you are a safe doctor, you are confirming you are right before writing, but you have to save your time as well, you have to secure good marks as well. Okay, so here most of the people will be aware like macrolides, clarithromycin you cannot prescribe with the statin drugs, and here you can see here is the atorvastatin. So what you have to do, I will discuss this case before writing the prescription. So I have copied these things from the BNF, most of the things. So case discussion, in the case discussion it is saying there is an interaction between the clarithromycin and the statin. So to confirm this, you have to open the BNF on the macrolide and the statin interaction section. Okay, so if in the stem, this is very important, if in the stem instead of the clarithromycin doxycycline is given, then there is no interaction between doxycycline and the atorvastatin. You can simply pretend you are opening a BNF and you can just start writing. So this information is from the BNF. You can read this if you want. So after reading the case note and after reading the task, you will move to the prescription, and here you can see in the prescription writing, this is the front page. You have to write the details. You have to write the consultant details, hospital name. You have to write this information by hand. There will be no sticker. But for the patient, most of the time you have to just take a sticker from the given sheet and just paste it over here. So then there is nothing to write in the once only section, nothing to write in the oxygen section, and we will straight away move toward the antibiotic section. So what we are going to write, we are going to write the clarithromycin. That is very important. And yes, I missed one thing that was important in the above section, and that was patient was not allergic to anything. You have to write no known drug allergies, then write your name, and then you have to signature, and then you have to write the date as well. If patient was allergic to something, you have to write patient is allergic to penicillin, the drug name over here, and then you have to write the reaction, breathlessness, itching, or the skin reaction, anything you will write over here. So then we will move into the antibiotic section. Here you can see we have written the clarithromycin. We have to write the dose over here, that is 500 milligram. Route is oral, and the start date. So the start date will be your exam date, and count it like your exam date, the next day, next day, next day, and next day. So if your exam date is 1st of January, don't start from the 2nd of January. The first day of the antibiotic will be 1st of the January. Okay, so the 1st, 2nd, 3rd, 4th, and 5th will be the last day of the antibiotic. You have to write all the dates over here, and then write the timing, 8 in the morning and 8 in the evening. So it should be regularly, there should be a proper interval, like the regular interval, that will be the 12 hour. And then you have to write your name and the signature. GMC number is very important for your antibiotic writing. Then you have to write your bleep number, and that says indication is the community acquired pneumonia. In this way you have to write the clarithromycin. Now you will get the 4 marks definitely, because the main task was to write the antibiotic. And the next section you will move on is the regular medication section. But again, you have to write the consultant name and every other thing which I have explained earlier, and you have to write the patient details, or you have to paste the patient sticker as well. In the regular medication, as we saw, only one medication, salbutamol, was the PR, and rest of the medication were regular. And we also noticed there, like, you cannot write atorvastatin with the clarithromycin. So patient is on the atorvastatin already, 20 mg per oral, and he is taking that atorvastatin at the bedtime. So you have to put cross for the 5 days. Those 5 days you are giving antibiotic to patient. Okay, so if you want to write the 1 2 3 4 5 all the dates here, if you have time, do it. If you don't have time, just write the start date over here. So you have to put the crosses in the 5 days. These are the days where you are giving the antibiotic to patient. So the next medication was the prednisolone, 30 mg oral, start date, end date, that was for the 7th day. You have to write your name, and then you have to write the bleep number, and prednisolone was in the morning. So these are the 7 days, and after 7 days you have to put cross. You will write stop date over here, and then you have to put the crosses as well, just to make sure no one is going to give the antibiotic more than steroid more than 7 days. And then you have to write the ramipril, that is the regular medication. Just write the dose and signature. It put on the morning. Aspirin 75 mg, just do the signature again and select the morning over here. Okay, in this way you will write all the regular medication. So no more regular medication, only one medication is left, that was the PR, and you will go for that medication in the regular medication, in the as required section. So here we go, we are in the as required section. You can see this is the salbutamol. So while writing the salbutamol, one thing is very important. So salbutamol comes in different concentration, like this is the 200 micrograms, sometimes you may get 100 microgram, 400 microgram. So just writing 1 to 2 puff is not enough. Okay, you have to write the strength as well. If you're not writing the strength, you may they may deduct your marks. So salbutamol 200 microgram, and write the microgram in full, and 1 to 2 puff inhaled INH 6 hourly, maximum in 24 hours is the 8 puff. Then write your name, signature, date, and the bleep number. So that's all. In this way, guys, you have to write your prescription. We have written the as required medication, we have written regular medication, and we have already written the antibiotics as well. And in start we write the details with the allergic status. Thank you very much.